Hello, my name is Dr. Jeffrey Terrell from the Department of Otolaryngology at the University of Michigan Medical Center. And today I'd like to speak about allergic fungal sinusitis. What does a patient need to know about allergic fungal sinusitis is sort of the goal for today. And so I'll describe what allergic fungal sinusitis is, some of the principles of treatment, and then discuss how you might find a qualified ENT surgeon to help you treat this if you have allergic fungal sinusitis or perhaps somebody in your family. Allergic fungal sinusitis is an infection of the sinuses with fungus, and it's distinguished by several features. One, there has to be fungus in the nose or sinuses. And then there has to be this allergic response to it, which is typically a lot of inflammation and swelling, and polyps form in the nose and or the sinuses. And then if you're to look at these patients on CAT scan or look at their tissue under the microscope, there would be certain pathologic findings on scan or under the microscope as well to meet the criteria for allergic fungal sinusitis. What about a patient? What might a patient notice? Well, patients may notice symptoms that develop over days to weeks, some nasal blockage, some pressure over the face, sometimes not severe pain, just low-grade pressure. Patients often have some drainage, sometimes some solid sort of fungal material will come out of the nose. Oftentimes there's some decreased sense of smell, but mainly if it involves both sides. And then some patients can have headaches, but usually it's lower grade pressure. Some patients have eye symptoms, some bulging of the eye or swelling of the eye or double vision perhaps even. What's your doctor looking for to help make this diagnosis? Well, they're looking for polyps on the exam. This is those allergic polyps. They're looking at the CAT scan to find three things in particular. One is to find evidence of fungus on the CAT scan. It looks a certain way. They're looking for evidence of polyps on the CAT scan and evidence of expansion or erosion of the walls of the sinuses, which occurs with the fungus and the reaction to the fungus. So what does the nose look like? When you look in the nose, there's a septum which goes up the middle of the nose, and then labeled here you can see a turbinate, which is on the side wall of the nose, and there's actually a little turbinate above it as well. And so the air goes between the septum and the turbinates as it passes through the nose. But if there's polyps there, in the next slide you'll see that there's polyps between the septum and the turbinate, and that of course blocks the air passageway and causes a nasal obstruction. These are the types of polyps you might see in somebody with allergic fungal sinusitis. On a CAT scan, you can see the same thing. Here are the eye sockets on either side on the CAT scan. The septum goes down the middle of the nose. Those little turbinates stick out on the side wall, and the white arrow points out the black air, the air passageway on the CAT scan that's open in this particular patient. This is a fairly normal-looking CAT scan. But if there's disease and polyps, you can see that black air passageway in the center part of the skull area is blocked by polyps, and in this case some fungus as well. On the CAT scan, your ENT doctor is also looking for evidence of fungus, which is a lighter colored gray material on the CAT scan. This is because the fungus accumulates some metals and looks brighter on the CAT scan, more like bone because it's got calcium in it, magnesium, and other metals. And then finally, there's some expansion. So you can see how this nose, things are sort of pushed outwards by the fungus. It's even pushing into the eye socket and sort of bulging into the round eye socket that make it no longer sort of round or circular in size. And that's the expansion that you see. So your surgeon is looking for the fungus, the polyps, and the expansion. What about the goals of the surgery? Well, the goals of the surgery for the surgeon are to remove all the visible fungus from all the sinuses. Now, this can be technically challenging, and this is where an experienced surgeon is critical, because you want to open those sinuses up or have them all opened, and then the surgeon should irrigate those sinuses. These are the principles that any knowledgeable surgeon about this disease should be talking about with you. Before surgery, Occasionally there's some bacterial infections that need to be treated with antibiotics, but many times it's just fungus. And then preoperative steroid pills can shrink the polyps and make the surgery easier for the surgeon and the patient, and probably make the outcome a little bit better as well. Typically, the operating room, we have video cameras attached to an endoscope, which you see at the bottom of the screen, which says a light source, and then we can project the images from the scope onto a video monitor. You can see that we have our CAT scan images in the background as a map for the surgery, and small cutting and grasping instruments to help with the surgery. Again, after the surgery, there are some principles. Steroid pills are necessary to minimize the allergic reaction as one is healing and prevent polyps from forming and trapping the fungus. Irrigations help remove any little bit of microscopic fungus that was there. And antifungal pills, well, they're actually controversial. They're usually not necessary. Most patients do well without them, but occasionally they're used. They do have the potential for side effects, so they're not used without good reason typically. If you have allergic fungal sinusitis, you really want to find a surgeon, an ENT doctor that's got experience and does a high volume of sinus surgery. Just like anything else, the more you do, the better you get at it. How do you find a high volume sinus surgeon? Well, you might want to find the specialist within a large ENT group. Usually that's called a rhinologist. Somebody who's the go-to person in a group for difficult cases. It's probably always fairly safe to go to an academic medical center that sees more complicated sinus cases, and you can always ask in a group of doctors who does the most sinus surgery. You may also ask a pulmonary allergy doctor that refers commonly to ENT doctors who they recommend. To find somebody knowledgeable and skilled, again, a rhinologist at a medical center is fairly safe. You probably want to ask the surgeons about some of these treatment principles, whether they can repeat some of these principles and seem to be knowledgeable about the principles. You can ask them about the rate of complications. You could do a literature search on the surgeon's name to see if they've published anything on sinus surgery, and you can also ask your local doctors about sinus surgeons. What other factors should you consider? Well, nasal packing is something that most patients hate. At the University of Michigan, we don't use nasal packing, or we use small amounts of absorbable packing, but other surgeons use large packs for a day or several days. For patients with significant medical problems like heart or lung problems, or elderly patients, you may want to ask, what's the reputation of the hospital and the affiliated specialists at that hospital in case you do need to get admitted to the hospital. You want to know about the post-operative care. It's extremely important. If the surgeon is experienced, they'll explain how important it is to do the post-operative care, and they'll explain how critical it is for follow-up. And you need to make those follow-up appointments. My name is Dr. Terrell. I hope this video has been helpful to you. I'm limited to 10 minutes here on YouTube, so I've put my contact information here. If you have allergic fungal sinusitis, we'd be happy to give you an opinion about treatment. Thank you.